get ready for more COVID-19 related restrictions. The chief medical officer of health says an announcement is coming, but won't say when or what action the government will be taking to curb climbing cases. Those numbers hitting a record high today at 797.
Alarm bells are ringing louder and louder. The time for concern and great concern is at hand.
Dr. Williams also warning today that positivity rates are up across the province. The virus is spreading in schools, he says, long-term care homes, and among our older population. And taking a closer look now at those 797 new cases, our graphs spiking to new heights. That eclipses the previous record of 732 that we saw back on October 2nd. 4 new deaths reported today in the province as well. The rolling 5-day average has jumped to 622. Toronto, Ottawa, and Peel Region account for 73% of the new patients, but significant caseloads have also been recorded in York, Halton, Simcoe, Muskoka, and Durham. And provincial labs set a new record yesterday, processing more than 48,000 tests, meaning the positivity rate is at about 2.1%, although it's higher in areas like Toronto, where Dr. Williams says it's closer to 3%. Another 58,000 plus tests remain in the backlog. 200 people are hospitalized, with 47 in the ICU. Meanwhile, 100 new cases are being reported in Ontario's school system. And this all adds to growing concerns a second wave will make a devastating sweep through long-term care homes again. Close to 2,000 residents have died, and today the province's patient ombudsman called for immediate action to prevent more deaths and revealed in familiar, heartbreaking detail what went wrong when COVID first struck our province.
It's almost like an elder genocide, and was begging me to take her home. Begging me.
From March to June, when hundreds of vulnerable residents were getting sick and dying and families cut off from seeing them, complaints to the patient ombudsman went up by 370%. The stories are haunting. An elderly woman who hadn't been moved from her bed to her wheelchair for months due to lack of staffing. Families who couldn't see loved ones as they lay dying. Lack of communication and PPE. Positive residents in the same room as negative ones.
They are sitting ducks. It's like an invisible wolf in a henhouse.
The Ombudsman has 4 recommendations to help prevent more mass suffering during the second wave. Every long-term care should have a partner hospital. Essential caregivers must be allowed to visit. Resources for better communication and enhanced whistleblower protection. Today, the Ontario Health Coalition held a motorcade rally at Queen's Park calling for increased staffing and pay and better conditions for residents and workers.
We're just looking at the patient ombudsman report this morning, which shows that in one home, they lost 2/3 of the staff. And I don't know how that would be allowed in any other healthcare setting, in a daycare or any other situation where people are vulnerable and need care.
The Minister of Long-Term Care has come under intense fire for the province's COVID response, in particular for not preventing staff from working in more than one home and spreading it further. That was a lesson from SARS. Today, she said they learned from the first wave.
The earlier we get in to the long-term care homes when they have cases, the better off it is for the residents, the staff, the hospitals, and the community at large. And that's what's happening right now.
As of today, there are 57 long-term care homes in outbreak. That number has been rising. More than 300 residents and staff are confirmed positive.